it is also a beautiful day. The Social Health Authority was rolled out on the 1st of October. Today being the 3rd of December, it's about 3 months. So this means it's about a 3-month-old baby. So far, according to the Cabinet Secretary of Health, Deborah Mlongo, she says 15.2 million Kenyans have been enrolled in this particular program. But then this authority, the SHA, continues to have its own teeth in gaps. And even as we continue just to have more Kenyans enrolled, what should really be done? On this particular morning, we are glad to be joined by the CEO of the Kenya Medical Training College, Dr. Kelly Oluoch. Thank you very much for joining us.
Thank you.
It's 1 year since we actually sat here. I think exactly 1 year.
Almost 1 year.
Yes, the last time I think it was on the 4th of, was it the 4th or 14th of November, thereabout, discussing the strategic plan for KMTC, 2023 all the way to 2028. So, karibu sana.
Thank you.
First off, many are looking at you and they're wondering, we have maybe seen his face somewhere, or we may be knowing his name. Well, many people know KMTC. You could tell us who Dr. Oluoch is, what KMTC really does before we continue.
Thank you so much. My name is Dr. Kelly Oluoch, the Chief Executive Officer, Kenya Medical Training College. Kenya Medical Training College has 97 years of experience in training mid-level health professionals. You can imagine this institution started in 1927 with 4 students. Currently, the student population is 66,807. We have moved to graduate many graduates. Particularly this year alone, we are going to graduate 21,261 graduates. And this is going to support us in the UHC, rollout of SHA, and making sure that universal health coverage is successful. The institution is present in 45 counties, out of the 47 counties. We currently are working with the Samburu County to make sure that we are in the 46th county. And that essentially is supposed to support counties be able to have adequate skilled health workforce to support SHA, to support universal health coverage, and to make sure we are successful. The institution has grown in leaps and bounds, but not just that. KMTC has also sustained and maintained its quality of training. On Friday, on the ICS Awards, KMTC emerged the top institution in the education category. This award has been won by KMTC in 2 consecutive years. Basically, making sure that as an institution, we adhere to the highest level of standards when it comes to training mid-level health professionals. Additionally, the institution has continued to attract more and more applicants, and has continued to ensure that we have quality in the process of training, and have continued to have increase in the number of graduates each and every single year. And this is to ensure that not only do we give opportunities for employment locally, but also make sure that we contribute to the health workforce that work in other countries. So as an institution, we remain competitive. We remain very focused with our strategic plan 2023-2028. And we want to ensure that the institution stays on track, is able to embrace technology, able to embrace change, able to ensure that it aligns to research, innovation, and consultancy mandates, and ensure that it is a sustainable organization working with communities, ensuring that we have efficient use of the little resources we get. Yes.
And Dr. embracing technology is one of the things that was mentioned on Thursday during the stakeholder forum between KMTC as well as the Social Health Authority, the stakeholders who were there, the speakers who were talking on that particular day. It was one of those things that were mentioned, among others. Could you break it down for us, just to understand the relationship between KMTC and the Social Health Authority? 3 months in so far, why is KMTC is it being onboarded right now? Help us understand that.
KMTC is very integral in the success of Social Health Authority. Number one, by the fact that it is the training arm at the Ministry of Health. It produces adequate skilled human resources that are useful for ensuring the success of rollout of SHA, since the SHA rollout envisages that many more people will be onboarded, and therefore there will be a rise in the demand for health care services. And therefore that cannot happen without human resources for health. So KMTC is very integral in that. Secondly, Kenya Medical Training College identified, together with stakeholders, some gaps that would be then addressed through training. And therefore we worked with stakeholders, both private insurance companies and NHIF, before it was rolled off, to develop a course in medical health insurance.
Right.
The reason why we need this course is to make sure we have the ability to have an efficient running SHA.
So, sorry to cut you short. Before you even get into now the diploma course, on the SHA, first off, what are your thoughts on it? You talk about the gaps. Are these gaps okay? Is it normal to have teething gaps before something grows into what it was envisioned to be?
It is true that organizations, as they strive towards excellence, embrace what is called continuous improvement. Continuous improvement is the realization that you will not always be 100%. But however, you will continuously identify gaps in your endeavor for excellence and continuously address those gaps to make sure that every single day you are getting better and better. SHA, definitely being a new organization, requires certain rapid results initiatives to be taken to make sure that we onboard everyone. And definitely, as a new entity, there will be the initial teething issues that must be addressed to make sure it succeeds. For example, there must be ability for people to enroll into SHA, and there must be development of packages, benefit packages that then benefits those who have enrolled into SHA. And at the same time, there must be public embracing the SHA and making sure that they make deliberate efforts to register into SHA. As it is, our role as Kenya Medical Training College has been to work with 2 counties, that is Homa Bay and Kisumu counties.
Right. Is there a specific reason why these 2 counties?
Not exactly,
right.
Because all organizations or parastatals within health were assigned various counties to work with.
Okay.
Kenya Medical Training College, as I have told you, is present in 45 counties. Yes. We could have been assigned Mandera and we would be very comfortable. We could have been assigned Wajir and we would be very comfortable. We could have been assigned Kwale and we'd be very comfortable because we have campuses on those regions.
Yeah.
But in this, we were assigned the counties of Homa Bay and Kisumu to work with. So the initial drive towards enrollment of people or the public into SHA needs a lot of effort and needs a lot of collaboration. And so we work with the county government, we work with the SHA officials themselves,
right.
and we work with the Ngao to make sure that we mobilize communities. We also work with community health promoters to make sure we reach each and every household to make sure that they register into SHA.
Yeah. So, and despite the fact that right now we're getting 15.2 million people who have, enrolled, that was as of last week. There is reports of miscommunication and Kenyans feeling that we're not getting the right facts and the right details from the government. You have listed, nicely. There is from the national government to the county government to the SHA officers. hadi ifike pale kwa mashinani.
Yeah.
And now, let's say, focusing on these two counties, Kisumu and Homa Bay, how does the flow of communication work so that if the first source says this is what you're going to be saying, that is the exact thing that goes to the common mwananchi?
Okay, SHA takes the lead because basically the agenda is within that institution. The county government and Kenya Medical Training College, we work as a consortium to make sure that registration is successful, that information that is being given to the public is accurate, and it enables public and stimulates registration into SHA. But it is a teamwork, and therefore all of us own the challenges, all of us own the successes of SHA, and in it, it also means that we must individually ensure that we put our all to make sure that the teamwork is synergistic and allows more and more people to get accurate information to sign into SHA, and also to be able to make sure that we properly communicate the benefits of being in SHA.
Right.
Yes.
So has KMTC started going to Kisumu and Homa Bay so far? And if so, what are the misconceptions about SHA that you're getting from the ground? When you talk to these people on the streets, they tell you, what are they telling you about SHA? We
have done a few activities in both counties. We have rallied and had medical camps. We have had, for example, also cancer screening. And we have mobilized communities to roll into SHA. The biggest issue that comes with the rollout into SHA is the level of communication and the distilling of that communication to the very lowest level to stimulate people to have the motivation to roll into SHA. The other issue is as you roll into SHA, most people have the misconception concerning their contribution. You know, SHA being a universal kind of insurance, everyone needs to know that they have to contribute into this pool to make it work. And therefore, it is not exactly a free kind of insurance. Everybody has to make sure that their contribution counts into the SHA so that it is able to support all continuum of healthcare, right from primary healthcare, level 1, level 2, level 3, and then higher levels of healthcare. All
right. And even as we continue, I think it should be prudent to let the viewer know how you can also register. I think also to just build up on that particular number.
We have star 147 hash.
Yes.
And this enables you to immediately even use your gadget to enroll into the SHA.
All right.
Star 147 hash. One country, 47 counties. If you forget, just know that it means one country, 47 counties.
Yes.
So that anyone having a phone should be able to register into SHA. But if you have challenges, then you can walk into any SHA office, you can walk into any KMTC, because we have done a lot to train all our front desk workers to be able to support in registration across all our 87 campuses. All our front desk workers are able to support you to register into SHA.
Or rather, you can also do HTTP :/SHA.go.ke to register as well. I registered, so I think even as we continue, I'm going to access star 147 hash and try. There's one of the options that gives you e-services, and when you prompt it, it tells you coming soon. We'll be getting to understand why is it not yet there. On Thursday, in your speech, you talked about primary healthcare services and the need to enhance them. When you focus on, let's say, Kisumu and Homa Bay, and as a professional in the healthcare system for very many years, what is your take on the state of primary healthcare at the moment?
Well, again, this is a work in progress. Primary healthcare requires a lot of support from communities and from families. And we rely right now on CHPs, and we also rely on level 3, level 2 hospitals to support in this. And in primary healthcare, Kenya Medical Training College has a lot of contribution. For example, we produce a lot of human resources for health that support at this level.
Okay.
We work with counties for training of CHPs. We have collaborated with organizations like AMREF to ensure that we train more and more CHPs and reskill those who are community health extension workers to be able to support into the human resource at this level. Additionally, we have additional human resources that we train at the institution that are very integral in the success of primary health care. For example, we have nutritionists who are supposed to help advise communities in proper nutrition, balanced diet, adequate nutrition, how to make sure we have sustainable food supply that then assures households are healthy. We also have public health officers being trained at Kenya Medical Training College. That is a very important course at this level. We have what we have called community health course that also is very important to support primary health care. Again, we have a course which is called Enrolled Community Nursing course, ECN course. And this is supposed to help counties which are marginalized, like Kwale, Mandera, Marsabit, so that we support communities to embrace healthcare. We also want to say that communities where we have mothers who are expectant should know what to do, how to ensure that they have all the antenatal visits, make sure that they deliver in health facilities to assure that we have skilled deliveries. We also need to promote nutrition, we need to promote hygiene, we need to promote public health. And Kenya Medical Training College has tailored programs that support at primary healthcare level.
Right.
Yes.
And now the fact that you're mentioning the kind of programs, I'd said we'll get back to now the diploma course you're talking about. You told us it's health insurance management.
Yeah.
Has it started rolling out? You can tell us about that?
We have the first class
of
50 at Nairobi campus.
Okay.
And we want to work with stakeholders.
When did it start?
We first had our first enrollment in September.
Okay.
Yes. First, before we enroll a program, we'll do a needs assessment. We identify what are the challenges that communities are facing, what are the challenges that organizations are facing, what is it that an institution like ours can do about those challenges. And it emerges that for us to have an efficient rollout of SHA and to have it work efficiently, we must learn from the NHIF that is now a defunct organization. What were the issues in the NHIF? Number one, how do you process claims? How do you make sure there's no fraud? And how do you make sure that you have a professional specifically skilled to ensure that the whole process, right from the point when you have to onboard a patient, have them admitted, claims management is properly done. And therefore, we lacked a professional at this level. Traditionally, we have poached professionals from other cadres, like nurses, like clinical officers, and trained them to manage medical insurance. But then they come from professions where we still need more health workers at those areas. So as an institution, together with the stakeholders, we identified that we need a professional in this area who can now address challenges right from the whole value chain that then leads to a satisfied client. And therefore, we worked together to make sure we have a curriculum that addresses the issues that were raised.
Right.
And then after that, there is now the first time now we are implementing that curriculum.
Okay.
We will work with stakeholders like SHA, like private medical insurance companies, to ensure that these professionals are attached to these facilities, they get the experience they need, and then after that, they're able to then work with SHA and other private medical insurance companies to improve on the efficiency, to reduce the level of fraud, to make sure that claims processing is efficient, and to work with hospitals to support in enrollment on SHA.
Right.
Basically, because the enrollment on SHA is not supposed to be a one-off. It is supposed to be a continuous process.
Okay.
Claims management is also a continuous process. And therefore, you must work with facilities to ensure that all these processes are efficient and effective. And therefore, that is why, together with the stakeholders, we identified that this was probably one of the most important ways in which we could work to support the government agenda in the rollout of SHA.
Right. How long is this course?
3 years.
3 years. So that means if they joined in September 2024, graduating, give or take, 2027?
Yes.
But then we definitely need right now kind of results. Does that mean that the CHPs, the community health promoters who are out here, do they have the knowledge that is needed for this health insurance management, or is there need for a refresher course for the same CHPs?
The CHPs will not definitely do what the health insurance management professionals will do.
But then a fraction.
But the CHPs can do very integral part, and that is registration. Support anyone who wants to register into SHA, be able to explain benefits, be able to explain the process of care in a public health facility, right from health-seeking behavior, right from being able to seek diagnosis, right from mothers attending all their antenatal visits, right from making sure that they are all onboarded on SHA, to make sure that right as the disease progresses to maybe a case of chronic illnesses, then patients are able to be taken care of throughout the continuum of care.
Right.
Yeah.
Before we get into matters of technology, because we had told Kenyans to continue registering even as we continue this conversation. So I believe some of them have started with *147#. We can just continue with the same registration. In case you feel like there are some questions you have, number 2047 is our SMS number. But there's one question that a lot of people even ask us right here. I don't know if you'd be best placed to give us this answer. The SHA is a household kind of a system. So if we are 5 in this household and each of us is above age 18, does it require that each of the 5 of us register, or just one person? How does that work?
There's the head of the household and 4 dependents.
Okay.
But above 18, each person should register.
Okay.
Yes.
All right.
Yeah.
So now, as KMTC, even as you now continue just focusing on, let's say, Kisumu and Homa Bay, talk to us about the technological advancements that have been there and are going to be there, and particularly the digital advancements, because SHA and the rollout of it is largely detailed in the digital space.
Digital space is very important in the rollout of SHA. Right now, the drive towards digitalization is to ensure 2 goals are achieved. That is efficiency and effectiveness. And to ensure that everybody who has a gadget has the ability to access registration. Digitization also makes it easy and efficient for anyone, anywhere, to be able to register. As an institution, we have had in our strategic plan the need to put digitization or digital transformation as one of our key agenda towards ensuring we have competent health professionals who are fit for purpose for the kind of work that they're going to do. Right now, what happens in health is that things change very fast, and most changes are digitally anchored. And therefore, as a trainer of health professionals, we have to ensure that in our curricula, we make it possible for learners to be able to embrace digitalization. What are we doing at training level? Number one, we have what is called an e-learning platform. An e-learning platform where all our students are registered into the platform and they're able to access learning materials through the platform. Number two, access to internet. All our KMTCs are digitally enabled. They have capacity to supply internet for our learners, and therefore any learner has the ability to access internet to be able to access materials that they want. Number three, we have what is called the e-library, where learning contents like books are able to be accessed digitally at the comfort of your room, at the comfort of your hostel. This enables our learners to be digital natives. And that means that they become able to use digital platforms right from the point that they are learners in our institution. And we also have what is called the Enterprise Resource Planning Platform, where all our activities as an institution, right from teaching and learning modules to finance modules, are all digitalized. And therefore, a student will be able to access their fee balances online. They're able to register into that platform. They're able to see their results online. They're able to do a lot, check their balances, fee balances online. And also, it enables the organization to be more efficient. So digitization is very key in the rollout of SHA, because essentially it enables us to store accurate data, be able to process claims efficiently, and to make sure that the whole process ensures that customer satisfaction is sustained and improved every single time.
Right. Let's talk about policy alignment when it comes to the Social Health Authority. What kind of, as an expert, what kind of policies do you think should be there that are probably lacking at the moment, or that are existent, that would actually see us accelerating UHC, that should really be implemented? A clarion call even for members of the National Assembly, members of the Senate, to actualize these particular policies.
The most critical policy when you go to digitization is basically protection of data. And we have Data Protection Act. Yeah. And it needs to be operationalized to make sure that, because you know, health data is a very sensitive data. And possession of that data could work to the detriment of the patient, because you do not want to visit a facility and after you leave there, all information concerning your health is available to third parties. So data protection becomes a very critical law in terms of ensuring that eventually when all our data is available, then number one, how it is stored assures safety. Number two, how it is used, who is able to access that data. And then the use of that data for decision making is also very key. But in all this continuum, the patient should be assured that the data that they are giving to a health provider is actually safe and is not going to be used in such a way that they are disadvantaged by providing that data. And therefore, what I think must be done right now is to enhance implementation of Data Protection Act to make sure that any health provider who gets access to personal data concerning a patient, that data is safe, and that that data is not given to third parties without the consent of the patient, because that basically becomes a very big issue. Because as health professionals, one of the things that we vow to do is never to diverge information obtained by virtue of our profession, by virtue of what we do. And therefore, data that belongs to patient is very sensitive data. And we are bound by oath to make sure that that data is not available to third parties without the consent of the patients or whoever has provided that data.
Right.
Yes.
And still on policies, do you think there's need to open up our borders and to open up borders even for SHA and our immediate neighbors, Uganda as well as Tanzania? Because case in point, someone is a truck driver and they efficiently use the insurance here in Kenya, but then they frequently use the Northern Corridor, for example. So that means that anytime they leave Kenya, they'll have to be, again, going to their pocket and removing money from there. How can this be achieved? Because again, when you take a look at Kisumu and Homa Bay, where KMTC will really be, it is very close to the borders. That means you're getting a lot of probably Ugandans there as well as even Tanzanians.
My opinion is that before we even think about borders between country and country, we should look at healthcare delivery between counties.
Okay.
Is every county having sufficient human resources to provide the kind of care that you need? What if County A has a professional that County B does not have? And a resident in County A needs to seek that service in County B. How do you prepare for a borderless, seamless provision of care? That needs to be enhanced. Counties need to work together. And as Kenya Medical Training College, we work with all these counties. Our bit is about human resources for health, to make sure that we have sufficient human resources for health for each county, and to ensure that each county is able to be as independent as possible, but it is not possible to be completely independent. So counties must be interdependent in terms of healthcare. So there should be, the SHA will answer most of these issues, because as long as you are registered in SHA, you are supposed to be able to access healthcare in any county, in any facility. And that basically means that we must prepare counties to make sure that they are ready to provide those services through the human resources for health that we train at Kenya Medical Training College. Coming to cross-border...
And sorry, so even before you get into another cross-border, still on the counties as well. So for example, if I went to a hospital in Homa Bay and I used the Social Health Authority, that insurance, is my data also available in all other hospitals across the country? Will that mean if tomorrow again I went to Kisumu, my data is there, so that means I don't have to again start telling them these are my problems?
One of the aims of SHA is to make sure that data is available, and that through unique patient identifiers, then the patient, like through use of IDs or through the use of thumbprints, then you are able to access that data. But that data should not be openly available without those unique identifiers. And it should eliminate need to carry papers all over, going with one paper from one place to another. If you lose your receipt, then you start all over again.
Even carrying a whole file of records. And
then you discover that you traveled from, let's say, Bungoma to Nairobi, and then you discover that you do not have one critical document. And then you are forced to go back. SHA should be able to support to avoid all this through digitization, to make sure that there is seamless access to patient information, but in such a way that the information is not subject to abuse, through use of unique patient identifiers that then allows that it's only when the patient appears and identifies themselves and has the kind of characteristic that can then be used to access that information, that is then when it is accessed, not just being available for anyone to access at all the time.
This would be wonderful if we are seeing it in the cross-border as well, wouldn't you agree?
It is, but one thing that we also need to be alive to is that countries have different laws. They are at different levels in their stages of healthcare provision. And it is necessary, basically, especially in East African community, to adapt a common approach that then allows citizens of various countries to seek healthcare across the border without the need to carry all the documentation across the border, but also the need for compensation once that healthcare has been provided in such a way that it is seamless without having to carry cash across borders. And that basically requires a lot of inter-country engagement to reach a point where a truck driver can leave Kenya and seek healthcare once they are in Tanzania or once they're in Uganda without the need to carry all the documents they have, because that information should be available. But you must realize that countries are at different levels of implementation of various healthcare strategies, and therefore it may not work 100%. Okay. But even if it works 50%, then it will be important, because it means that as you cross the border, you do not have the worry to think about a different insurance, a different mode of access to healthcare. If we reach a point where we can have 100%, then it will mean that we will have achieved a lot in terms of universal health coverage.
All fingers crossed on that. But then, I mean, you guys are training the best of the best out here. Tomorrow and Thursday is going to be a very, very busy day for KMTC. Tomorrow is rehearsals at Kasarani Stadium. And then Thursday is a big day.
Yeah.
Do you have butterflies? Because I know the 60,000 plus students, you can tell us the exact number who are graduating, but then they definitely have butterflies. It's a big day for them.
Yeah, the excitement is on the air. Most students have collected their gowns. They have shared in our social platforms, media platforms, how they feel about graduating. And their expectations after they graduate. And they have also shared with us, feedback is very important, and they have shared with us what went right, what needs to be improved. And as we move towards graduation on 5th of December, that is Thursday, this week, we expect to graduate 21,261 graduates.
Right.
This is a milestone, but as we look at it, then we should ask, what do we need to make sure that we give them a platform to access either further training or employment opportunities. As Kenya Medical Training College, we do several things to support in the skills that are needed for employment. Number one, we offer health entrepreneurship, so that in addition to being employees, then over a period of time, upon accumulation of sufficient capital, then someone can start on their own and be actually employers. Secondly, we enable those who have ambitions to go out of the country to access preparation. Number one, we have what is called NCLEX Preparation Center for those who want to work in US, Canada, Australia, New Zealand, to be able to prepare within 6 months. And then we have also negotiated for Pearsonville Center, which is an examination center, to be available in Westlands. We've done this together with the Department of Diaspora. So with that, then exam that was going to be done in South Africa can now be done in Kenya.
Right.
And that ensures that we cut the cost and the logistical challenges of those who would want to work in these countries by preparing at Kenya Medical Training College, sitting an exam here in Nairobi, and processing your papers for your onward opportunities.
Right.
In addition to that, we have an examination center for IELTS within Kenya Medical Training College for those who want to work in the UK. Additionally, we basically work with other organizations like National Employment Authority to prepare our graduates for the job market where they're going to work. And we have also ensured in our endeavor to train what we call fit for purpose human resources for health.
And that's
also,
the same thing.
Yes, yes. We have also ensured that we have foreign languages, which traditionally has not been offered at Kenya Medical Training College, like French, German,
Okay.
Arabic, and now we are looking at Amharic.
Okay.
For those who would want to cross over and work in neighbor countries like Ethiopia, so that they're able to basically work in a country of their choice.
Right.
Those who want to work in UAE and Arab countries, we have Arabic.
Right.
And this basically is to make sure that a health worker is able to communicate with the client or the patient, so that we do not have barriers that then lead to difficulties in diagnosis, challenges in design of treatment, and therefore ensure that we have people who are responsive to the environment where they're going to work.
Right. Actually, this means, and this goes to show how equipped these learners who are going to be graduating are definitely. But when you look at the numbers of these learners who are graduating, it was 20,000 thereabout. When you also look at the number of medical professionals who are there currently, vis-a-vis the primary healthcare facilities across the country, and those that are going to continue even growing due to the population of the country. Do you think 20,000 plus is a lesser number, because the ones that are in the primary health facilities would complain really of being overworked, because these primary health facilities are short-staffed?
Yeah, there are two things that you need to look at. Number one is the production element.
Okay.
Like, as Kenya Medical Training College produce over 85% of human resources for health that work at middle level across all sectors, both private and public hospitals. And Kenya Medical Training College graduates are the most preferred by employers across all sectors. But then that is not enough in terms of quantity of the human resources we are producing. We are there to the highest level of quality, because we are the most regulated tertiary institution in Kenya, because we are having more than 9 regulators regulating various courses that are trained at Kenya Medical Training College.
Right.
But more so, when we produce these human resources for health in conjunction with the needs analysis from counties, then counties should also do their part. And because health is devolved, we would have a challenge if we produce and the counties do not absorb. And therefore, we have, in this graduation, we've also invited governors to be able to learn about the courses we have, the kind of needs that they have, and merge the graduates we have with the needs of individual counties. Each county has their own need, by the way. We do not have a case where we have universal need. Countries, for example, along the transport corridors are susceptible to road traffic accidents. So we need courses like OTM, which is called, which is very important in addressing emergency accidents that occur in these corridors. There are counties where the issue which affects most populations is lifestyle diseases. There are counties where the challenges are infectious diseases and all that. So each county has their own unique demands for human resources for health. And what Kenya Medical Training College does is to identify these needs together with the counties, identify which kind of courses they would want in campuses that are resident within those counties, and make sure that we produce for purposes of the market demand. So we produce market-driven graduates. We first start with what is the demand, and then go into production, looking at what is the quality that is required from that health worker.
Thank you, Dr. I want, even for your closing remarks, you do it differently today. Look at your camera and invite people for the graduation. Just briefly invite them, and then we close it up.
Thank you. Kenya Medical Training College is going to graduate on the our graduates on the 5th of December 2024 at Kasarani. The event starts at 8 a.m. to 12:30, and we expect to graduate 21,261 graduates. We expect that we will have invited guests over 60,000, and so we wish to invite Kenyans, the whole public, to join us as we celebrate our heroes, the graduates of the year 2024. And we want to assure the public that as Kenya Medical Training College, we will endeavor to produce the highest quality of graduates who are going to address the challenges that we face as a country and also be able to work in other countries as they so wish. We want to ensure that we continue to listen to the public, listen to our counties, listen to our stakeholders, so that when we produce our graduates, they are the expected quality that our stakeholders want. So I want to take this opportunity to invite everyone to attend either physically or watch us as we graduate on the 5th of December 2024. Right. And remember to register for SHA using hashtag *147#.
Most definitely.
Thank you.
Thank you very much. I hope quite a number of you have registered so far at Social Health Authority. Thank you very much. Dr. Kelly Oluoch, he's the CEO of KMTC. This is Morning Cafe. Do you guys love maize? Because I do love maize. Ile mahindi boiled vizuri for breakfast. It's 9 a.m. time for breakfast. And that is what we're going to be getting into for AgriTalk, your weekly dose of matters agriculture, coming up after this short break, learning how you can be a maize farmer. Don't go too far.
Vile unavyojua watoto wengi sana hawana namna. Mimi ningependelea watoto wasome.
I'm here to stress on education. At the same time, let us actually do any kind of sport that we are doing. Sport speaks the best language to everybody.
Tunataka tutafute talents. Zile raw talents kutoka kule nyumbani mashinani mahali tuko leo.
Hizi mbio za Chepsaita, like all other sports, zinaleta watu pamoja.
We want to use this event to uplift the lives of the community.
Anafurahia hii mchezo sana. Hata sikaange naambianga watu tuende Chepsaita.
Wanafunzi wakimbie ili wakuze talanta ya mbio ama kuhimiza tena elimu.
This is the place to be. Hapa ndipo mahali wanastahili kuwa tarehe 7. Wale watoto walikimbia last year, wamekimbia mpaka wamefuka mipaka zetu za Kenya.
Hey there friends, welcome to Kids on the Block, where fun and imagination come alive. We dive into magical world filled with exciting adventures and awesome friends.
What position were you in?
I was number 2.
What position were you?
Number 1.
He decided to cross the bridge by his house and look for food on the other side.
We're going to do half cup of chocolate chips, and the other one, we're going to do half cup of the blueberries.
So, grab your imagination hats and get ready to explore with us. Join us every Saturday at 9 a.m. for new friends, amazing stories, and tons of laughter.
Join us as we explore the journeys of those who defy the odds and break barriers. We dive deep into the stories of triumph.
Sometimes when parenting a child with a special need or whatever disability, family life becomes a bit complicated and you may end up raising the child on your own.
Here, we inspire.
I have a farm which one we showcase with other dyslexic youths and autism how to farm.
Motivate.
It's never easy, but what we do, the best thing is to work with another parent who has an elder child than yours.
And break through the barriers one story at a time. Push your boundaries beyond the limit. Saturdays at 8 p.m. The Grind, where business meets brilliance. It's not just
Thank you very much Stanley Nyarenkita, na bila shaka nakupata kwa njia ile shwari katika kaunti ya Elgeyo Marakwet, na leo tumezuru katika eneo la Kapsoya ambapo iko katika kaunti ya Uasin Gishu. Leo tunajifunza mambo mengi yanayoambatana na kilimo